in and the patients that have a very debilitating disease. I am Jim Kiley. I'm the Director of the Division of Lung Diseases at the National Heart, Lung, and Blood Institute. And before we start, I'd like to introduce the panelists that are here today that are going to help us present this plan to all of you. First of all, we have on my right here Dr. Mei-Lan Han. She is the Director of the Women's Respiratory Health Program and at the University of Michigan in Ann Arbor. Next to Mei-Lan is Grace Ann Dorney-Koppel. Ms. Koppel is the president of the COPD Foundation. And on my left, Harold Weimer, who is the executive director of the American Lung Association. And so we're all here because this is a plan that has been developed by the entire COPD community, and I think you can see that there's many individuals here who have had a very active role in this plan. I just need to remind you all that the material here today and this discussion is embargoed until 1 p.m. At 1 p.m. there is a session in the exhibit hall, and that's labeled under the NIH Theater, where all of you can come and hear a little bit more about the details of what is in the plan. So that is the official period of time where we will announce it to the entire ATS community and the American people as a release. Let me just set the stage here for you a little bit in terms of what we're going to discuss today. Chronic obstructive pulmonary disease, that's COPD. Many of you may know this disease as chronic bronchitis, emphysema. This is the third leading cause of death, right behind heart disease and cancer. What's really disappointing and discouraging is and so we really do have a serious public. In fact, in the United States, 6.5% of the population has COPD. So that amounts to about 16 million people that have COPD. Look around this room. 1 in 5 people have this disease over age 45. You know someone that has COPD. You may have it. You may not even know you have it. But you know someone. So this is incredibly important to this country. It's a huge public health issue. So many people have it. Many may have it, don't even know it. And so we do have a very big issue on our hands. In fact, it got the attention of the Congress a number of years ago. They highlighted the importance of chronic obstructive pulmonary disease, and they encouraged the National Institutes of Health to work with the community stakeholders and other federal agencies to develop a national action plan to respond to the growing burden of this disease. And part of that is a quote directly from the Senate Appropriations Committee report. So the COPD stakeholder community, the federal government, and all of the partners that care about this disease got together to develop a set of core goals that the National Action Plan would address. This sort of evolved over several years, so it was not something that was developed with a quick turnaround. It was very thoughtful, deliberative, and it was meant to obtain the broadest amount of input possible so that we could get it right from the start. Today we're here to announce for the first time a COPD National Action Plan, which has been developed with input from the entire COPD community. It provides goals and objectives. Everyone in the nation affected by and interested in COPD can work towards to help reduce the burden of this disease. Each goal is designed to address a different aspect of the disease and the part of the community with the capacity to address it. The 5 goals are empower patients, their families, and caregivers to recognize and reduce the burden of COPD, to equip healthcare professionals to provide comprehensive care to people with COPD. The third is to collect, analyze, report, and disseminate COPD data. Fourth goal is to increase and sustain COPD research. And fifth is to turn COPD recommendations into research and public health care actions. And there's a number of materials around that you will be able to obtain here or next door that will allow you to get more details on the plan. We have a preview copy of the plan in hard copy, a little bit of it for the press next door, and we'll make that available to you so you can get more details about what is in the plan. Again, this is material that will be presented in a bit more detail at the NIH Theater a little bit later on. What's important about this plan is that it belongs to the entire COPD community, from patients and their caregivers, to healthcare providers, to federal partners, to advocacy groups, to professional organizations. Everyone can and must play a role in supporting and moving this important plan forward. If we don't all own this, then we will not make the progress that I think is needed to stem the epidemic of this disease. And I can't emphasize enough that we all own this plan. So what I wanted to do next is transition to allow the panelists that we move through in order of who's here next.
All right. Thank you so much, Jim. So, as Dr. Kiley mentioned, I am a chest physician at the University of Michigan. I also do, COPD is also my primary area of research, and I'm involved in developing the COPD guidelines for hospital and quality improvement. So this is something that I live and breathe every day. And but speaking personally, this is something that I see every day. I see the suffering and the toll that this disease takes on my patients, and I can't convey to you enough the level of frustration that I have as a physician in not being able to provide the level of care that I want to be able to provide for these patients. And I think as the action plan outlines, that we face some serious barriers to being able to deliver adequate care for this group of patients, whether that's problems with access to providers who are knowledgeable about the disease, whether that's access to affordable medications, whether that's being able to get in to a pulmonary rehabilitation facility that's close and convenient, whether that's getting education materials. And then I think from the research side of things, there's frustrations around not knowing enough about the disease. We certainly have good treatments, but we need better treatments, and I'm so excited to see the NHLBI one being caused of death in the U.S. We really cannot afford to lose these individuals who are not just all old men, which is, I think, what sort of the perception is. We have a lot of young individuals, we have a lot of women. These are people that need depth. We really need engagement from all of the key stakeholders if we really want to improve care for COPD patients.
Much, Dr. Hahn, and I think, again, Melan, I think, speaks very well for the entire pulmonary sleep critical care community, as well as all physician scientists that are doing research in these areas. So we're very grateful for your comments. So next I want to introduce Harold Weimer, who is the Executive Director of the American Lung Association. American Lung Association, as all of you know, is a very, very key stakeholder.
And for that reason, the American Lung Association is truly very proud to be a partner with NHBI on the first ever COPD National Action Plan. And we really look at this as being an opportunity to really improve prevention, detection, and treatment and management of COPD, because when you can't breathe, nothing else matters. COPD is definitely one of the leading causes of both death and disability in our nation, and many living with this disease struggle with even normal daily activities. Raising the level of awareness for COPD is definitely critical, and we feel that this action plan will allow us to raise that level of awareness so that COPD patients can get the level of treatment that is so much needed. So the American Lung Association is in full support of the action plan. We are committed throughout our nationwide organization with our more than 300,000 volunteers and staff across the country to really mobilize and work with all of our lung health partners in our communities. And we feel that this action plan, Dr. Kiley, is really giving us the opportunity to bring us together and to work together on this initiative with those 5 key targets that have been identified in the plan. The American Lung Association works closely with the American Thoracic Society and the COPD Foundation and a number of other COPD patient advocacy groups in this effort, and we feel that that's really what it's going to take for us to be able to take this plan, put it into action, and to make a difference. So from the American Lung Association, I just want to share our commitment to making this happen and to continue our efforts. The American Lung Association has been involved in working with COPD patients for more than 50 years. Altogether, we're the nation's oldest voluntary health organization, more than 113 years old. But I can say that for the past 50 years, our organization has been working to educate individuals who are suffering from chronic obstructive pulmonary disease. And I know early on it was emphysema, and then as it has evolved to COPD through our Better Breathers Clubs. We have more than 500 Better Breathers Clubs across the country, and it really gives us an opportunity to bring these individuals into the network and to make sure that we're able to incorporate the objectives that have been laid out in the plan with our COPD patients through our Better Breathing Club. But then we also look forward to the opportunity through our Airways Clinical Research Center, which really has a focus now on COPD and asthma, but as another way to offer the infrastructure that we have through our Airways Clinical Research Center to help expand research efforts with our partners and to be able to also share important data and information and outcomes, which I know is also one of the critical goals of the, we're very pleased to be a part of this initiative. It's an opportunity for all of us in the community, and I just want to personally thank you, Dr. Kiley, for your leadership from NIH and